Hi everyone, I'm Joy Rosa with Earthworks Acupuncture, and we're back again with special guest Kendra Sims, researcher and educator who crafts data-driven narratives to improve population health. So welcome back, Kendra.
Yeah, and I'm glad to be back for round two.
Round two. Um,
Yeah.
in the midst of the coronavirus pandemic, we've been through a wide range of emotions, and we're not only navigating those, but also our coping mechanisms. And so, Kendra, you've researched a lot about stress, and now I think is such a healing time to bring more educational awareness on how it affects our bodies according to Western research. So I wanted to let's begin by understanding our own health in our own terms during this time of quarantine. So Kendra, can you please talk to us about stress and how it impacts our bodies?
What we're all going through right now is completely natural. It's a completely natural response to stress because we've evolved to have what's called a fight or flight response. And it used to be very effective. Well, it kind of originated as a way to escape danger or to confront danger. Let's take just an example of like a tiger. If you have a tiger in front of you, what do you need to do? You need to get away from it, or you need to defeat that danger. So that's
tiger.
yeah, that's a tiger. So just it's just that our bodies can't tell the difference between, say, a tiger and all the other modern stressors we experience.
Right. And I would love to add on a few points taken from a class that I took with Lydia Ann M. Bartholow, who is a psychiatric mental health nurse practitioner. And the class was called Beyond Trauma, Understanding Neuroscience, Epigenetics, and Health Justice. And Lydia explained that we see trauma in many different scopes and noted the difference between stress and trauma. So trauma, big T, is usually only viewed like one big event. Like historically, we've really recognized that it is a physiological response to war, as seen in our war veteran communities, versus little t trauma, which is like the spectrum of, say, structural violence, featuring racism and colonization as a collective unit of trauma. So I just thought I'd add.
No, those are very great points, and that could probably be a discussion for a later date. But yeah, just in general, what's going on in our bodies is that in our endocrine system, it releases what are called hormones, and they're just these little chemical signals that we need to get ready for. We need to ramp up and confront this stressor. So it makes our heart beat faster, our eyes dilate. Our blood flow is getting redirected to the things that are going to help us escape or fight, which are our muscles. And so it means that there's less blood flow and energy going to, say, our digestive systems or the things that aren't immediately needed. So yeah, all that's going on.
Yeah, and I just also wanted to kind of tack on that these hormones include a hormone called cortisol, which is released due to stress, and it can be seen, um, as a heightened hormone due to long-term stress. So long-term stress, and really stress in general, can look like irritability, mood swings, aggression, immune suppression, which is a big one that we're seeing right now with this coronavirus. Lots of people are stressed out, but it's also attacking our immune systems. So there will be another topic to discuss there, but it can also inhibit water retention, hyperglycemia, insulin resistance, muscle breakdown, which is what you were kind of getting to, higher gastric juices in your stomach, and can also affect bone health. So this is why, actually, Kendra, can you tell me if this is why there's a positive correlation with, say, stress and higher risk for disease? Like, would
It's
that
probably, yeah, no, these are all great points, and I'll get, that the answer is probably, but there's a lot of different pathways that stress can lead to poor disease, and that's what my research is all about.
okay.
Because, yeah, no, I I fully believe that that's contributing to kind of this, even this theoretical link that, you know, even a common, like the average person would think between, oh, if you're stressed out, you're going to um, have a higher risk of disease, because despite the fact that if you didn't ever get stressed out, you would be dead, because it's an essential function to get you through life. But especially with chronic stress, it puts so much wear and tear on your bodies, all those processes that you were talking about. If your body is always in the stressed out mode, it isn't doing what it needs to do for the long term. So it's going to break down. So we're going to see that, oh, you might develop insulin resistance because your body is just like, I just need to survive, so I don't need to have a regulated level amount of blood sugar in my body, because who knows, that's really low on the priority when you're stressed out, when your body is stressed out.
Right, and I'm thinking also in terms of like long-term chronic stress, that brings to mind ancestral trauma and stress responses to that kind of ancestral trauma. And this is part of what epigenetics is. And I'm actually going to link a really cool TED Talk at the end of this to further kind of explain what epigenetics are all about. But basically, epigenetics is the study of the biological mechanisms that will switch genes on and off. So, you know, we've seen a lot of that like over time, like chronic symptoms of stress.
Yeah, down to a cellular level, your environment, like especially stressors in your environment, are trying to protect you. But also, you know, kind of on that macro scale in your day-to-day life, part of that stress response might be behaviors or things you do to cope with it or manage it. So that's another part of it. So a lot of established risk factors for disease are, you know, involve, say, unhealthy behaviors. Maybe it's a lot of comfort food, or maybe it's, you know, smoking or using substances. So it's the things we do to cope with stress are another essential part of, another essential, I guess, link in the chain between how stress leads to poor health.
Yeah, definitely. And I just think about, you know, here you are with a stressful situation, here you are with your body's natural response, right, in terms of like bringing in hormones and also immunosuppressants. And then here we are faced with this virus too. So it's like all of the things at once. And you know, your outcome then is affected greatly by all of this.
Yeah, because human beings are really good about trying to self-regulate. So if that thing you do to comfort yourself really brings you short-term pleasure in your brain, you don't, of course you're not thinking about like, oh, or maybe you are, and it's less important than feeling good in that moment, which is completely understandable. It's pretty natural.
Yeah. So earlier this week, I spoke with Dr. Parker T. Hurley about their practice with dialectical behavioral therapy, DBT, and how we can learn to soothe our bodies by understanding and utilizing our wise mind, which involves the limbic system. So the limbic system is a part of your brain that deals with your emotions and your memory. And it regulates the autonomic or endocrine functions in response to the emotional stimuli, like the emotions that are like impacting you. So it, as well as somatic responses, and somatic responses are like the nervous system's responses that are associated with structures that are under voluntary control. So basically like your skeletal muscles, right? So like if you're in a stressful situation, you know, you can kind of like feel yourself kind of contracting. Also, you know, stress impacts the prefrontal cortex, which is the brain's region that deals with a lot of planning, complex cognitive behavior, personality expressions. Lots of decision making happens in the prefrontal cortex, and also moderating your social behavior. So all of these things, right, can be impacted just from stress alone.
Yeah, stress, it's a big driver in our day-to-day lives. And, you know, if it's, and it, I think coronavirus is a great example of just like what people are aware of how much health risk it could cause, but
Mhm.
just all of these complex things it's doing to our day-to-day lives, it's just other layers of stress that's being put upon us.
Yeah. And I really admire the fact that the medical teams, both um, uh, traditional Chinese medicine teams and Western medical teams, were coming together in Wuhan, China. And I read a post about the Wuhan doctors teaching the patients Qigong and Tai Chi while they were in the hospital, which, there's a lot of studies about body movement and body movement therapy that will reduce cortisol levels and stress levels. And so I think that that is one of the key factors that we often miss in the United States is, well, we understand your regular coping mechanisms, which might not particularly be very healthy or healthful to your own benefit. But here we have, in another culture, in another country, people really kind of surrounding, right? Like that it is part of their culture to have this daily practice and regimen. And so to be at the, pinnacle of this pandemic and implement that as one source of healing, I found that really impactful. And, now they've been able to reduce the number of cases to zero and go and help other countries. So I found that really quite fascinating and something to really be highlighted.
Yeah, I think we all should be looking at the way other cultures and health systems cope and deal with stress, because our American model is not very effective right now, between all the uncertainty, which is stressful.
Mm-hmm.
And, I don't know, I don't want to decry social media, but maybe this is a time to limit your rabbit hole down that conspiracy theory or that argument that's going on about what's going on with the state of the world. I think there are small measurable things within our control, which I think is empowering and de-stressing. Just like there are tiny things I could do to take a step back and, just be with, just kind of be to be slightly less stressed, or at least have outlets for it.
Yeah, absolutely. And just wanting to pedal back a little bit to Lydia's lecture, all this neuroscience is pretty neat to learn about, and there's so much more. And we're just beginning to graze the surface of what epigenetics are while talking about the body on autopilot and its response to stress. So, right, luckily neurons are malleable, and that can be positive and negative, right? Because um, let's take the positive though. So you're thinking patterns and responses, and so using this space of this DBT model of therapy, where you're invoking your wise mind or your higher mind or higher consciousness or divine self, whatever you want to ascribe to it, um, is innate in everyone. And it's a space where we merge to live and to heal. So with this practice of training your mind, right, with different modalities that we've seen in other cultures that work. Um,
Yeah, I completely agree, because from what I know about DBT and a lot of these other modalities, it's all about, you have that stress and you have that response, and it's just kind of automatic, but maybe it's about slowing down and maybe decoupling that
right,
stress and that response.
right. And when you're doing that practice, that's why a daily practice, 5-10 minutes a day, just a daily kind of regimented practice, those neurons are actually going to get larger, and your body is going to tend to ease into that space much quicker of de-escalating your stressors and your stress responses. So I thought that that was something worthy to be noted.
Definitely.
So tell us a little bit about like any kind of studies or anything that have um, described either like what groups of people get sick more often or.
I mean, just in general, it looks like people who are under stress do and definitely engage in behaviors as a result of that and have a higher risk of disease because, you know, it is a privilege in our society to be able to manage stress
Mm-hmm.
and manage our health. And I think those are closely tied. You know, if you have a lot of control over your life in general, you have a lot of control about taking away stressors or avoiding stressors. But there's large groups of the population, either people of color or people of lower socioeconomic status, who don't have that luxury. So, you know, I have a lot of compassion for people who have to go out and stock our shelves and package our stuff for us right now because, or, you know, our healthcare providers who have to be on the front lines and cannot escape
Mm-hmm.
that stress, who are both vital to keep everything going and also are dealing with a lot of uncertainty and stress firsthand all the time.
And so do you think that, you know, these studies that have been describing or maybe have stopped describing what groups of people are getting sick more often, or to point out these coping behaviors, like, do you think that this impacts what, you know, doctors, regular doctors in the healthcare system might say to you to prevent health problems? Do you think it's
Um,
impacting it?
I mean, I think definitely the status quo of a lot of healthcare providers is to do things like eat better and exercise more. And it seems to just kind of have a blanket statement about what we know does prevent health, but there's this gap between what we know does prevent poor health outcomes and what people can do in their day-to-day lives. I think that's where, you know, there needs to be more evidence and a push in especially healthcare practice to address these kind of system level factors.
Yeah, absolutely. And there are a few books that I'm going to be linking below that talk more in depth about trauma and stress and how to better understand when your body is having an activated response. And just a side note, I say activated because the word trigger, as a mixed Indigenous and African diasporic identity, that just hits too close to home. So I try to kind of shift gears and say activated. But Kendra, I really love Fridays with you
Oh
and
yeah.
talking and nerding out a little bit on research
Yeah.
of specific etiologies of diseases.
Yeah, of course. Anytime I'm just here at my makeshift standing desk and dealing with all of these tigers that keep, you know, barging in all the time. So many tigers, but you know, it's so many tigers. Just gotta,
Just walking and running through them.
yeah, it's just a herd of tigers. But yeah, this is great.
One tiger at a time.
Yeah.
So we're going to be back on Monday with Dr. Jembo Lee to expand upon the ways in which traditional Chinese medicine understands, diagnoses, and treats symptoms or branches of stress, as well as specific root causes of stress. And also hone in on how really training your mind, whether it's through, again, daily meditation, Qigong, yoga, mindful walking, or cooking, or anything, is really a dynamic and integral part in combating stress and its effects on your body and overall holistic well-being. So stay tuned for that on Monday. And Kendra will have you back on hopefully next week or the week after to discuss some more.
Yeah, sounds good. Thanks so much.
Awesome. Thanks, Kendra.